Hi, everybody. I'm Taylor Martin, and the drug I chose to do my research on is Adderall. So a little bit of history and background on Adderall. It actually belongs under the category of amphetamines. So for this reason, and for the purpose of this presentation, I'm going to be referring to it as Adderall or amphetamines pretty interchangeably. Amphetamines are a type of psychostimulant, which, as we know and have discussed this semester, have an energizing effect. This is why the original purpose of creating Adderall in 1996 was to treat those with attention deficit disorder. It's classified as a Schedule II drug, which means it has a high potential for abuse. Adderall is made up of a 1:3 ratio of the stereoisomers levoamphetamine and dextroamphetamine, which are both forms of amphetamine salts. Amphetamine has a very similar chemical structure to the amino acid phenylethylamine. Notice that the difference between the two lies in the amphetamine having an added methyl group to its side chain. This added methyl actually protects the molecule from the enzyme monoamine oxidase, which would otherwise break down the drug pretty quickly during digestion. Because of this, amphetamines are able to persist in the system, getting into the bloodstream and causing the effects to last longer. The original form of Adderall was an instant release form, meaning it was dissolved and absorbed quickly. However, this also means that its effects wore off rapidly and needed to be taken multiple times a day. This caused highs and lows in the plasma concentration, reducing its efficacy and increasing its adverse side effects. Adderall XR was later introduced as an extended release form, meaning it dissolved and was absorbed over a longer period of time. This way, it can be taken once a day and still remain just as effective. Both forms are tablets taken orally, which we can assume means that it's able to withstand the stomach's harsh environment, make its way into the bloodstream, and eventually cross the blood-brain barrier. It takes about 3 hours from the point of administration for each stereoisomer to reach its peak concentration in the blood for both forms of Adderall. Once the amphetamine is in the body, metabolism starts in either one of two ways. Carbon 4 of the benzene ring is oxidized into 4-hydroxyamphetamine, or the alpha or beta carbon on the side chain is oxidized into alpha-hydroxyamphetamine or norepinephrine, respectively. From there, the 4-hydroxyamphetamine and norepinephrine are further oxidized into 4-hydroxynorepinephrine, while alpha-hydroxyamphetamine is deaminated to make phenylacetone. The phenylacetone is then finally broken down into benzoic and hippuric acid. About 50% of the administered dose is recoverable as alpha-hydroxyamphetamine in the urine, while another 30 to 40% is recoverable as amphetamine itself. The recoverability varies based on the pH and the flow rate of the urine. So urine with a higher pH tends to show less elimination, while urine with a lower pH and an increased flow rate have higher percentages of elimination. Any amphetamine not renally eliminated is metabolized in the liver. When Adderall is taken as prescribed, it increases dopamine levels as well as focus. But when it is taken inappropriately, it causes too much of a buildup of dopamine and norepinephrine that it is unable to be broken down or taken back into the neurons. The dopamine is unable to be broken down because, as I mentioned before, amphetamines inhibit monoamine oxidase. The receptors responsible for inhibiting dopamine release are also affected. Adderall abuse becomes highly dangerous when used simultaneously with other drugs of abuse and can have lasting effects such as depression, paranoia, trouble sleeping, just to name a few, when they're taken over a longer period of time. Through the research I did on Adderall, I found that it's very effective for treating those with ADHD and narcolepsy, as it increases your energy, your ability to focus, and your concentration while decreasing your distractibility and hyperactivity. It does, however, have a high potential for abuse, and it is highly addictive, especially among college students looking for a way to study longer, as well as those that are chasing a euphoric feeling that it once gave them when they tried it. Its high affinity for addiction causes its abuse to easily lead to a physical or a psychological dependence. Taking Adderall with another drug, specifically a depressant, puts the body under immense amounts of stress and increases your risk of overdose, heart failure, stroke, or even death. I think more education around the topic of amphetamine abuse would lower rates among college students and also reduce the stigma surrounding it. I also think increased testing should be done to help prevent the abuse of Adderall, as well as jumpstart treatment for those that need it. So by this, I mean doing more extensive screening before prescribing it to ensure the patient actually needs this drug. This would cut down on overprescription of amphetamines and in turn some of the abuse. Also, implementing a way to safely abstain someone from the drug if they are found to be abusing it, either through therapy or a treatment program. I will touch on my thoughts regarding food in a few slides. To highlight a few studies that I found interesting while doing this research. The first, looking at the efficacy of Adderall as opposed to Ritalin, which is another drug commonly used to treat symptoms of ADHD. 25 children with ADHD were randomly given either a low dose of Ritalin, a high dose of Ritalin, a low dose of Adderall, a high dose of Adderall, or a placebo. They found that these children responded to Adderall at much higher rates than the Ritalin. Their parents and teachers also commented on their improved behavior both at home and at school. It was noted in the study that the low dose of Adderall was about equivalent to a high dose of Ritalin, and that the low dose of Ritalin tended to wear off around midday. A second study sought to understand how individuals using non-medical prescribed stimulants, or NMPSs, like Adderall, simultaneously with alcohol were affected. This study surveyed over 4,000 college students. 10.6% reported using NMPSs, while 4.9% reported using these stimulants with alcohol. This study found that those reporting using NMPSs with alcohol were twice as likely to have severe alcohol-related consequences than those that only drank alcohol without the use of the stimulants. The final study looked at how Adderall affects a person's creativity. And I thought this was very interesting because it was so much different than any of the other research I had come across. The participants were administered either Adderall or placebo, and then underwent a series of 4 creativity tests, 2 requiring divergent thinking and 2 requiring convergent thinking. Divergent thinking refers to coming up with multiple ideas or solutions to a problem, while convergent thinking refers to trying to reach one solution. This study found that Adderall hindered the way most people performed on the convergent tests, but seemed to have little to no significant effect on the divergent tests. Some limitations I found in the research of Adderall, one being the use of self-report surveys. You are heavily relying on a person's honesty and openness to share their drug abuse habits and history. A possible solution would be to gather a sample population through a blood or a urine test instead. There is also a lack of studies done that show the effects of Adderall when there's food in the system. Most studies intentionally have the participating individuals keep an empty stomach while testing the effects of Adderall. I'd be interested to see if, similar to alcohol, having food in your system has an effect on the rate at which Adderall is dissolved and absorbed into the bloodstream.